Elder care services, determining your level of care. The condition of the person seeking nursing care is the key factor in your choice of a long-term care facility. All skilled/intermediate care nursing facilities provide personal care and residential services, including rooms, meals, planned activities, and programming to meet social and spiritual needs. The levels of nursing and therapy services offered vary quite widely, and these should be carefully matched to the individual's needs. The resident's physician is involved regularly in the direction of a resident's care. The nursing staff works with and keeps the resident's physician updated on any changes in the resident. Sheltered care. People who are functionally independent but need some assistance in daily living require the care of a sheltered care facility, SC. Sheltered care facilities emphasize the social needs of the individual rather than the medical needs. Dietary and housekeeping services, medication monitoring, and leisure activities are primary functions of these facilities. Assisted living. People who are mobile but may need assistance with one or two activities of daily living may require the services of an assisted living facility. An assisted living facility is a congregate residential setting that provides or coordinates personal services, 24-hour supervision and scheduled and unscheduled assistance, activities, and health-related services, is designed to minimize the need to move, is designed to accommodate individual residents' changing needs and preferences, is designed to maximize residents' dignity, autonomy, privacy, independence, choice, and safety, and is designed to encourage family and community involvement. Intermediate care. People who need 24-hour nursing care by licensed nurses as prescribed by a physician require the care of an intermediate care facility, ICF. Rehabilitative programs, social services, and daily activities for persons not capable of full independent living, such as persons who are convalescing or persons with chronic conditions which are not critical, are provided. Physical, occupational, and other therapies are also provided. This type of facility may be certified to participate in the Medicare and/or Medicaid program. Check with each facility. Skilled nursing care. People who need 24-hour care require the care of a skilled nursing facility, SNF. Registered nurses, RN, licensed practical nurses, LPN, and certified nurse assistants, CNA, provide care and services prescribed by physicians with heavy emphasis on medical nursing care. Social services, as well as physical, occupational, and other therapies are provided. This type of facility may be certified to participate in the Medicare and/or Medicaid program. Check with each facility.
For more content like this, please visit learnforfree.biz.
Content produced and distributed by AllSuperInfo. All rights reserved.
Transform your old articles and ebooks into brand new audio content and use it to create podcasts or videos for your YouTube or TV channel. Visit allsuper.info and ask our live support for details.